Hello, everybody. This is Lisa Johnson from Everbridge, and welcome to our webinar today, Crisis Communications Lessons from Chris Turnbull at Carilion Clinic. We're going to go over our agenda today, a few logistics, and then we're going to hand it over to Chris, who will talk about what Carilion Clinic does and what their importance is to the local community. We're going to discuss the events of the shooting on August 26th, a little bit more than a year ago. And then Chris is going to go into how he implemented the Code Silver, getting the crisis communication team together and the type of planning that they do at their healthcare system, and then how the plan played out during the actual crisis, as well as lessons learned. You can contact us after the webinar at marketing@everbridge.com, and you can follow us on Twitter at EBHealthcare on Twitter. Chris, I'm going to introduce you now. So he is the Public Relations Manager for Carilion, but he is also in charge of their emergency planning program. He leads the public and media relation efforts for Carilion Clinic, a not-for-profit healthcare organization serving nearly 1 million people in Western Virginia. He advises senior leadership on communication matters and oversees their public relations program. Chris's career spans 15 years, including institutions such as the World Bank, where he was a valuable member of the institution's emergency management team. He created crisis response and communication plans, developed and led leadership training programs, and conducted more than 100 simulations. Chris personally responded to scores of international and domestic emergencies, including coup d'etat, earthquakes, hurricanes, and terrorist attacks. So at this point, Chris, I'm going to turn it over to you. Thank you so much for coming in today.
Absolutely. I'm glad to be with you all, and make sure I get the slides up here too, Lisa. We're going to jump right in, and I will take a step back in a second and kind of give you some context, but I thought it would be useful for you to hear basically the first phone call I made into the hospital about a year ago concerning this incident. So give me 2 seconds. Here we go.
Dispatch, Brandon.
Hey, Brandon. This is Chris Turnbull in Public Relations. How are you this morning?
Doing fine.
I'm good. I want to give you a heads up on something that might be coming your way that's super high profile.
Okay.
It looks like Channel 7's morning show, while they were doing a live shot from Smith Mountain Lake, they were either shot at or injured. The camera was dropped. They're trying to figure out what's going on there.
Okay.
So it's a reporter and a cameraman, possibly from Channel 7. I don't know if you've heard anything from them. They were in Westlake.
We haven't. Okay. Cameraman and a reporter. Do we know if they were shot at this point?
We do not. They're still trying to figure out what's going on. I'm going to call the station here in a second and see if they have any word yet.
All right, sounds good. Just keep us updated, and I'll let our transfer center know as well so that they can prepare the hospital.
Great. Thank you.
All right, thank you, sir.
Thank you.
So that was one of about 6 phone calls that I took part in about 5 minutes following the initial shooting at around 6:46 a.m. And they're haunting. I just found those calls not too long ago. Our dispatch center records them, and I asked to get the calls so I could kind of listen to, rethink about the event a little bit. And there was a great amount of effort made that morning to do what we could for our reporter friends, in addition to the other victim, Vicki Gardner, who was the interviewee that morning on the morning show. Other important phone calls that took place that morning that I think would be useful for you all to hear, because I think it gives a flavor of our community and the type of environment that we live and work in. 2 of the first few phone calls to the general manager at Channel 7 that morning came from our CEO, who the conversation went something like, anything you need, you have it. And then a few phone calls later, the station across town, the competitor station to Channel 7, our NBC affiliate, Channel 10, their GM called Channel 7 and said, you take care of your people today. We're going to be shooting video and shooting footage for you all day long. Don't send any of your people out. We've got you covered today. And they did that for a couple days. So I think it's important to give you a flavor of the type of community in which we live. We did put a helicopter, you see on your screen, this is one of our 3 lifeguard helicopters. We put them, one of those on standby that morning, and another phone call that I made a couple minutes after this indicated to me that that helicopter was being taken off standby, that they would not be needing it, and that gave me a strong indication of what the day and next week or so was going to look like. I want to take a step back. I certainly want to tell you about our experience with the shooting, because my hope is that your learning about our lessons in this case will improve the next time you have to deal with something like this. But I'm also hoping to give you some of the infrastructure behind crisis communications and our planning at Carilion, in the hopes that the next time that you have to deal with a situation like this, you're a little bit more prepared. Not that you can ever be truly prepared for something of this nature. This is Roanoke, Virginia on your screen. We are a small city, about 100,000 people in southwest Virginia. We're about 4 hours from Washington, D.C., tucked in the Blue Ridge Mountains. Right on that ridge line there you see across the top of the screen is the Appalachian Trail. And we are an outdoorsy community. We have a lot of outdoor amenities in our area. And the quality of life here is off the charts. Crime is low. It's one of the reasons that I chose, and my family and I chose to move here about 5 years ago from the Washington, D.C. market. And it highlights the fact that these types of incidents can happen almost anywhere in the world, and that we all do need to be prepared for that. Let me tell you a little bit about Carilion. We are a nationally ranked integrated healthcare delivery system. We have about $1.5 billion in revenue every year. We operate 7 hospitals. We have 240 or so practice sites in the area, in about a 20-county area. We are the largest private employer west of Richmond, so in the western half of Virginia. We are the largest private employer with 13,000 employees and nearly 1,000 employed physicians as a part of that. We also have the distinction of being the designated level 1 trauma center for our region. So 150 miles in any direction out of Roanoke, we are the closest thing that people have with regards to a trauma center, a level 1 trauma center. We operate urgent care facilities, pharmacies, home health, and hospice care. We have patient transportation. We have 3 helicopters and about 50 ambulances that serve that region that I was just telling you about. We operate our own allied health school with about 1,200 students. They learn everything from bachelor's of science in nursing to doctorates in nursing, masters of public health, and degrees like that. And then we also have a joint venture partnership with Virginia Tech on a medical school and a research institute that are both just a stone's throw away from our flagship hospital, which you see there on the screen. That's Roanoke Memorial, Carilion Roanoke Memorial Hospital. I tell you all that to give you a flavor of Carilion, but I also tell you it because in an incident like this that affects our community, that impacts our community so much, we recognize, we know we have a greater responsibility in our community to fulfill their needs. And this case was no exception to that. So we'll talk a little bit about our role, but suffice it to say that our chief executive and our other executives, as well as our physician leaders, know just how important we are to our community, and we take that role very, very seriously. So let's jump back into the incident for a second, and I am going to unwrap this a little bit for you, just to kind of give you a timeline. Shots were fired around 6:45 that morning. You can see my initial text message to my boss just soon after that, and I usually go out for a morning run, so I was not actually watching on television that morning. But I had just finished my run, and a colleague called and said something terrible's happened. It looks like Adam and Allison were shot during their live spot. And within about 10 minutes, I was able to get more information from both our own operations and the station. I called the back office number for the station to try to get them on the line and see what we could do to help. CTAC, you see that in my text message, that's our Center for Transportation and Coordination, and they operate and do all the logistics behind dispatching our helicopters, ambulances, placing people in beds in our hospitals throughout the system. And they are usually the epicenter for an incident like this. They have the greatest amount of intelligence about what's going on. So I went to them first. Our team was pretty much activated at 7 o'clock that morning when we knew we were going to be receiving the third victim of the attacks. And a trauma alert was called at that point to respond to her needs. Code Silver is an interesting code at our hospital. We know that other hospitals have something similar. It may not be called that, but that indicates for us that there's a security threat to our emergency department, and it raises a level of caution and our emergency department. We tend to lock, quote unquote, lock it down. That does not mean we stop seeing patients. It does not mean we stop letting patients in. We just do additional security measures to ensure that the people who are coming to the emergency department truly need to be there and are not a threat to our staff and our patients. We use, and I gave you an example of the type of alert we might use in a situation like this. If we were to have some sort of active shooter in the hospital, this is an example of the type of message that might go out to staff, both through our Carilion Clinic alerts powered by Everbridge, and I'll go into that in a little bit, but also perhaps over the PA system and through other communications channels that we have. You'll see something interesting in that, though, is that the last sentence in that alert indicates that our staff, and these alerts do go to our staff, should go to this link to get an active running list of the communications related to the event. So it's a place where we always go to. It's internal to our organization, so it's protected information for them to be able to see a running communication about what's going on with whatever incident it is we're facing. We've used it quite a bit with weather, for instance, with snowstorms or potential flooding. So we do use that alert page quite a bit and use Everbridge, or our Carilion Clinic alert system, to point people in that direction so that they get the right information at the right time. And as you might imagine, many of you may have this in place too, we have a lot of template alerts in place for events that we know we're going to face, and that's important. So let me stop here, and Lisa, if you could help me do this poll. I thought we're going to talk a little bit about the crisis communications team, the crisis communications plan here in a second, but I'm curious to see how many of those who are in attendance have a crisis communications team in place. And this is, and I should say this for us, is aside from our emergency management team. So we'll give you a second here and just answer that if you would.
Yep, hello Chris, breaking in, this is Lisa. The poll is running, people are voting furiously. So if you can do it another 10 seconds or so. I will close the poll and launch the results. Sometimes everyone can see it. So I'm going to close the poll now and then share the results. Hopefully everyone can see that on their screen. So for people with a crisis communication team, 46% have one, 36% don't, and 17% are working on it. So definitely some opportunities to learn some stuff here today.
So through my experience, what I can tell you is that beyond having a plan, so a plan's pretty important, but more important than a plan is find those individuals who would be able to assist you if you had a crisis communications need. If you don't have a plan, you can come up with one with that group, but if you don't have a team, a lot of times individuals in that position can feel like they're struggling out there in the wilderness. So getting a team, getting a support group around you, people who can cover for you, who know the elements of communications, the channels that your organization has, that's pretty important. I'm going to talk a little bit about the team that we have in place, and we've tiered our team. As I mentioned, we're a pretty large organization, about 13,000 employees, and we are located in, it's something ridiculous, like 280 locations in a 20-county radius. So being able to get information to and from that group of employees is critical for our response. We know that. Typically, when an incident like what happened on August the 26th of last year pops up, there are 2 or 3 individuals that get alerted to that from our operations. Now, that incident itself, I actually knew more about it prior to the hospital because I, like many others, thousands of others, saw it on television. So it was somewhat unusual for me to be calling our CTAC. More often than not, they call me and say, Chris, this is brewing. Just want to give you a heads up that it's happening. So there are 3 of us, the Vice President of Marketing and Communications, myself as PR manager, and then our PR specialist, Hannah, who is our right-hand person in an incident like this. We get an initial alert, and we make decisions on who else we might need. And we'll talk about sort of the function around this team and what we try to accomplish. But if we need to, if this event is going to overwhelm the 3 of us or has the potential to overwhelm the 3 of us, we activate the Tier 2 level, which is currently about 15 people. And they cover everything from staff communications to patient communications, our web presences, our media relations, and social media. And a Tier 2, I'll give you a sense of a scenario like that, and August 26th would not have been a scenario like that normally. However, because we had intelligence that the shooter in this case was traveling near the hospital, we decided that we needed to activate the next tier of that as in addition to our incident command team. If it truly overwhelmed that group, or we thought it was going to overwhelm Tier 2, we would have called in the rest of our marketing and communications department, which is about 50 people strong. And each of those individuals beyond the 20 or so from Tier 1 and Tier 2 has a position description that they are able to use when we give them instructions following an activation. And those additional position descriptions are the 5 that are listed there in the lower part of that column for Tier 3. So family assistance, how would we assist our families? What type of communications needs would they have? Media monitoring, so just monitoring what's going on all the different channels. Media liaison, with many media on the scene, we may need additional staff to make sure that they know where to go and what to do. Setting up a news conference, and this is an important one and one that is often overlooked, making sure that the group is fed and cared for while they're managing a critical incident. That's what our team looks like. What I will tell you is I'm probably going to be making some additional changes to this based on some recent incidents that we faced. And you should consider your team constantly evolving as well. You should be learning from incidents that you face or exercises that you have so that you're constantly improving on the process and the team. To give you a sense of how we plan for crisis and on a communications front, these are the elements of our planning process. And perhaps one of the most important ones is that first one on the top. What does that look like? We get together with people from HR, from risk management, from legal, from communications, from emergency management, from our police force. We sit around the table and we talk about the types of events and interactions we could have that pose a great amount of, that threaten us from a communication standpoint. And then we rate those threats based on impact, how much of an impact a particular event might have, and frequency, and how frequent it might occur. And we come up with a score, and based on those, we identify our top risks, and those risks are the ones that we focus on addressing in our plans. There is no dearth of risks that a health system or hospital faces, and so we find that every year we go through this process, we wind up adding additional risks that we want to address in our communications plan. So it's a good process. It's one that we've used now for 2 years, and it's something that we've gotten good feedback on so far. The planning itself, the developing the plan, is actually probably the easiest part of this. Once you have those risks identified, putting the checklists in place and getting that squared away is relatively easy and doesn't take too much time. What does take a little bit more time is the message templates, which is an essential part of a mature plan. And again, those message templates are based on those top risks that we face. So we are focusing our resources on the areas that we know we're going to need to address. We put guidelines together. So if I, for instance, or Mike, or my VP, or Hannah were not available, would others be able to pick up the ball and run with it with a little bit of guidance? So we have a guidance document that goes along with the plan that sort of gives indications on how to be a spokesperson, an effective spokesperson, and what are the policies and procedures that govern patient privacy within the hospital or healthcare system. I'm going to share with you the aid memoir that we put together because that too has been a very effective resource in my previous roles before I came to Carilion, and has proved to be a very effective resource here too. And I'm not going to spend too much time on it now, but it can't be overstated that training and practice your response almost every single time. The more you can do it, the better you get, the more effective you are, and the better the outcome. All right, so let's go back to another poll here, and I always like to kind of get a sense for how many are engaged in planning. And while I'd love to say that a plan is complete, I truly believe plans are never complete. So Lisa, you're opening up a poll, it looks like. We'll give a couple.
Yep, it's up and running. People can vote.
There's tons of templates out there for plans. Many different agencies can help develop plans for you. The only thing I will tell you about a plan, I think the biggest bit of advice I can give you is if you do wind up working with an outside party, make sure the plan exists within your own culture and your own community within your organization. If the plan has structures that are outside of how you would normally do things, it's unlikely that that plan would work in a crisis. So spend your time and make sure that it's well molded to your organization. And do we have the results? Lisa, could you share with me?
We have. Yeah, hopefully everyone can see them. 55% said yes, that they do have a crisis communications plan. And I know that's something that the Joint Commission prefers everyone has, so I think that's kind of interesting. 22% said no, not yet, and 23% are working on it.
Yeah, and I think we all could probably say we're working on it, even those of us who have it in place. That's great. Well, here's what our table of contents looks like for ours. It's not dramatically long plan. Long plans tend not to work very well in a crisis. Those of you who've been through that would probably know. Key objectives and assumptions are a level-setting part of the plan to make sure everybody's on the same page. We do throw our risk assessment summary in there, and it basically highlights the risks that we've identified and gives us scores, and it's a reference piece. It's not something I would typically turn to in a crisis, however. Where I focus on is that response phase and the recovery phase, because we want to make sure that the checklists that are in those sections address the needs that our colleagues have as they respond. And then, of course, plan maintenance is critical too. And from our standpoint, we at least update the plan once a year. But more often than not, we will update it immediately following an after action from an incident that we faced. So I want to give you a sense of volume and about how Carilion, how many incidents Carilion faces in a given month. I've started to keep track of this since January just because I knew it occupied a good portion of my time. I've classified things into concerns, issues, or crises. Concerns are those things that might bubble up but probably won't. Issues are things that will bubble up and may die pretty quickly on the vine. And then a crisis for me is when I've activated a level of the team. And on any given month, we face about 10 of those combined. So issues, concerns, and crises. We face about 10 of those per month, one way or another. Some of them are community-related events. Others are internal things. But it really does run the gamut. And frankly, it keeps things interesting. So that's okay by me. Let's talk a little bit about how that team that I showed you before gets activated. And again, we use Everbridge for that. We are able to, based on our Active Directory lists that we have in our email system here, we are able to send alerts to any of those lists as long as we've loaded them into Everbridge. So the Crisis Communications team has an email list that I'm able to use for non-urgent messages. When I do need to get them a message, and the 4 that I will likely send them are right there on the screen. An FYI that something may be brewing, an alert that they will likely need to activate, an activate message with directions on where to go and or who to call. And then an all-clear message to close the loop and ask people to stand down. As you know, probably in your organizations too, not everybody's here all the time. So making sure that those who are not immediately available for response do know that we've closed the loop and the incident is off the table. We've addressed it. We use this maybe once every other month. That's probably pretty accurate. And we get better and better as we go. We've had some lessons learned on this too, again, clear communications. And I should say, in a lot of cases, I will point people to their email to get more information. So we're constantly, this is constantly evolving for us as well, but it's been a helpful addition as our program has matured. This is the aid memoir card that I would share with you. I've blocked out a couple things because it shouldn't be public information, but the information you can see there, where we would meet. We have a conference bridge as well, where you can use after hours or when we're not on site. We have a regular incident command point of contact, and we have a crisis communications team point of contact, and there's information on that too for the card. On the flip side, and this is about the size of a business card to give you a sense, on the flip side is our standard agenda when we do meet. We do get together around an incident. And these are not, if you've ever been involved in an emergency management team or an incident command team, these are similar actions that those teams, in my experience, have taken, assessing the situation in terms of people, facilities, technology, communications, and operations, consulting with a plan, considering the communications impact as something specific for us, and then determining necessary actions is, and that's our guidance that we give to our colleagues on the crisis comms team. And we try to run through that in about 15 minutes so that the response can kick off and we can get through it. Let's dive back into August the 26th, the shooting at Smith Mountain Lake. And instead of taking it chronologically now, I'd like to kind of move back and talk a little bit about the audiences, because in our plans we talk a lot about the different audiences we would have to address. And as you might imagine, with an organization of our size, we have no shortage of audiences. The ones that we knew we needed to work with on the Wednesday the 26th were these. And it was probably the easiest one to guess at their needs was the media. With our experience, we knew that they wanted interviews, they wanted the patient's family, would love to have had the patient too. They wanted experts to talk about things. They wanted consistent communications and, of course, reliable, so information that was verified. We also knew what the patient needed, that time, space, privacy, as much as possible was going to be necessary for them, and whether or not they knew that at the time, that was really key. Vicki Gardner, the third victim in these attacks, and I knew each other 15 years ago when she was one of my first clients when I worked for a PR firm out of college, and so I had a relationship with her already. And even though I knew that she had good acumen around public relations and marketing, I think we all knew that this was going to be a level quite above what she had dealt with before. And so we knew that advice and counsel was going to be critical, not just for her, but for her family too, who were in large part taking a lot of the media interviews. The most important audience, though, and the Carilion employees are probably consistently our most important audience. We want our employees to know what's going on. We want them to be able to let others know what's going on. We want them to be able to be good ambassadors for the organization. So providing them with reliable information. And I hadn't mentioned it before, but both Adam and Allison, the two individuals who were killed in the attack, they were hometown kids. Adam grew up a couple miles from Roanoke and Salem and Botetourt County. And Allison grew up about an hour south of Martinsville. And so I think devastation is probably an apt word for how some of our employees that morning were feeling, because they grew up with them. They knew them very, very well. And in many ways, the community at large knew them because they were the faces you woke up to in the morning, and the ones who were going to tell you about all the fun things that were happening that day or that week or that weekend. So we knew that was going to be a critical need for our own employees. And lastly, and certainly not least, our community. I already mentioned before that we sort of take a leadership role on just about everything at different times in our region. And we knew that we had a place in this, a role to play in this response too. And that was literally to offer hugs and hold people's hands and tell them how to get through the grief and healing that would need to take place in our community. So let's break these down a little bit, 2 by 2. So here's what we did. The patient, we knew, was to minimize the impact on the patient, give them enough space and time to heal, the patient and her family, space and time to heal. And we knew we could do that in certain ways. And one of the ways we knew is if we could get in front of it with the media, we would be able to buy them time, and we always referred to it in that way. If we could open the tap just a little bit and let the flow of water come out just a little bit, it would buy them days so they could be on their own. So we approached the family the same day as the shooting and said, if you can give us 1 hour tomorrow morning, I think we can give you a couple days of respite. And they agreed, and the family, Vicky's husband and daughter, decided to run the morning show gauntlet with all the different national morning shows the following morning, where we did, I'll show you here in just a second, but we did about maybe 10 different interviews within the span of an hour, and were able to get Mr. Gardner back to the hospital within about an hour and 15 minutes so he could spend more time with his family. And that was a key tactic for us. You might think in a case like this where the national media is knocking down your doors that the national media would be the most important audience that we have. And I'm curious about your input on this. So we're going to go to this poll next. Would you prioritize local media over national media in a situation like this? And it looks like the poll is open, and I'll wait a second here.
We have a very decided opinion on this one.
Okay.
So definitely get your vote in if you have an opinion. I also want to let people know that if you have any questions that come up during the presentation, definitely please put them in the question box, and we'll be collecting them throughout the session. We already have a couple good ones in hand. Okay, so I'm going to close the poll right now, and you should be able to see the results. So 67% said yes, they would prioritize local media, 7% said no, and 25% said it depends.
I think that's pretty accurate. I would say the same thing. Every single incident that I've ever faced has been unique unto itself. We made the decision to prioritize local media first, and we did that for 2 reasons. We knew that the national media would be in and out in a day or two, and that they frankly didn't really care too much if they ran roughshod over people. We also knew that this was local media's story. These were their friends, their colleagues, and we at Carilion would be working with them for many years to come. So we made that decision to say local first, national next, and it was a conversation I had with every editor of every outlet, and I basically said, you're able to negotiate with all these folks if you want, but you guys are our priority, and they appreciated that, and it bought some time. It also humanized the story quite a bit, and it gave a chance for our community to shine through nationally, and that was key for us in our role at Carilion as a community supporter. Other things we did for the patient that worked well, we found a family media liaison. We acted in that role for them. We also found a family spokesperson, and you can see Pastor Troy Keaton up there in the upper right-hand corner of your screen. He is the executive director, he was the chairman of the board for the Chamber of Commerce, which Vicki worked for, and he was trusted by the family and did a great job, was comfortable speaking on television, and did a great job of passing word along. So that separated the family a little bit from that type of news gathering. We recommended that the Gardner family put up a recovery page on Facebook, and they did that, and I think that was a useful, there were many thousands of people all around the world who wanted to show their support for Vicki and wanted to send their condolences to the Parkers and the Wards, and that was a great way of doing that. That's still up there. I think it's Vicky's recovery page if you want to take a look at that. We did help them put a statement together to distribute after those 2 days. So the morning of the Thursday morning shows, we sent a statement out on Friday evening, again to buy time for the family over the weekend, so that they would not be bothered by media outlets over the weekend. And the last thing we did, we knew that when a patient is in the hospital, I have a good amount of control. I can push media off. We can keep their lives private and their business private. When they leave the hospital, it becomes significantly more difficult for them. And we wanted to make sure that they had some support outside the hospital. So our colleagues and friends at NDP agency, they're an agency based in Richmond, loaned their senior vice president of public relations, Thomas Becker, to the family to make sure that he could assist them as a liaison going forward. And that was, I think, very, very helpful, but also greatly needed. For the media, we did a bunch of things for them too, and we were in the studios at Channel 7 that evening. We were in there at 4 o'clock the next morning and continued to be with them throughout the continuing coverage of this. The lower right-hand corner, you'll see the image that I don't think this is actually the AP image, but there's an AP photographer in the studio that morning with us, and they invited Dr. Thomas Milam, who was our interim chair of psychiatry and behavioral health at Carilion, to come in and talk a little bit about grief and loss and the next steps and how do we move forward, how do we heal. Well, Tom is not only is he a medical doctor, he's also an ordained Episcopal priest, and that connection between the spiritual and the medical, I think, meant a lot to the community, and so he came out quite a bit during those first few days following the shooting. We did regular daily condition updates for the patient to keep the media at bay, again, to make sure that they knew they were going to get that every morning and that they could rely on that information. We also pulled the trigger the day of the shooting on a news conference, and we didn't know what the situation was going to be, and very quickly we said, let's clear this room, let's make sure all the equipment's in there so that we can host media if we have to. What wound up happening was that the responding authorities in Bedford and Franklin County put together a news conference that afternoon, which I attended, and provided updates to the media there. And so we did not ultimately have to have the media on site for that, which was our goal in the end too. We didn't really need them to be at our hospital as we're getting patients in and out. So those were sort of the ways that we assisted both the patient and the media. We knew those were key audiences for us. This is what that schedule looked like the morning following the shooting, and I'll throw that in there just to kind of give you a sense. The point here is that we went local first, WDBJ7, before you see down there at 6:50 CBS early morning show. We went with Channel 13, our local ABC affiliate, before Good Morning America. We went with our local NBC affiliate before we went with the Today Show, and CNN and others. So you'll see that throughout, and that was a key tenet of our approach and worked out very well in this case. For the employees, and they were, like I already mentioned, they were a key audience for us. What you may not have known about prior to this incident, about 2 weeks prior to it, we made national headlines before in the healthcare world because we had a breach. We had a number of individuals looking without cause into a patient record, and there were disciplinary actions taken against, I think, 19 employees. I desperately did not want to have to report on that story after this one. And so there was a message that went out to staff reminding them of the importance of patient privacy and only accessing a patient record if medically or administratively necessary. So those things were a part of our plan. They're now a solid part of our communications plan with a high-profile patient. And, of course, that morning we sent condolence messages to our staff, and our CEO was quick to send those messages. Many, many people, and the picture on your left here is a picture of one of the last live shots we did with Adam and Allison a few weeks prior to the shooting itself, right in front of the hospital on our greenway, a wonderful greenway system in Roanoke. I would say probably in the neighborhood of 24 or 25 providers over the course of the previous 10, 12 months had met and worked with Allison and Adam on various stories. So, and those were just the folks that worked with them professionally. There were a number of others who, a number from high school and college in those days. One of the most important things we did for our own staff and the communications team is about a week after the event, we pulled everybody together with our behavioral health department. And we had Dr. Tom Milam again come in and do a debrief with us on just how we were feeling following this incident. Many of our staff in our department, not surprisingly, are former reporters, former videographers, and took this incident very, very personally. And I think we had about 50% of our staff, about 50, come in for that debrief session. That is now a regular part of our planning too. We want to make sure that we are taking care of our own folks following a critical incident like this. And then, of course, the community. And I'm leaving them for last, but that was a really big part of our response too. We have on our team, just prior to this incident, we hired the leading female newscaster in our community who worked for Channel 10, the station across town from Channel 7. And I called her the morning after and said, is there a way that we could put together our own news packages on this to help people address concerns about grief and loss? And within a few hours, she had put together 2 packages, one about grief and loss, and the other one was probably even more important, and it was about how do you talk to your children about what they just saw on TV yesterday. And that was the first week of school for many children in our community. And at 6:45, I'm sad to say that thousands of children were watching when Adam and Allison were killed. And we knew there was a very big need to address that in the community. And I can only say that luckily my children were not watching, but they soon learned about what was going on, and it was jarring to them too. If you get a chance, and I know that Lisa's going to share the PowerPoint with you all, there's a YouTube link at the bottom of there. Unfortunately, video doesn't work so well over webinars, but there's a YouTube link, and I would encourage you to go and take a look at that if you get a chance. It's about a 2-minute segment talking to some of our providers and giving some advice and guidance on grief and loss. So what worked? What worked, what didn't work, what did we learn from this? And hopefully this will help you as you plan for your own crises and emergencies. Our system for keeping the media at bay worked really well. We were able to get in front of their needs. In fact, a couple national outlets told me that they'd never experienced anything where we were coming to them and saying, would you like this interview? The better part of the time that they have to deal with that is usually them asking and trying to fight to get those types of interviews. So we caught them a little off guard, and I was okay with that. That's the type of position we really wanted to be in. We were able to give the Gardner family time to heal. Local first, national next. Again, that is going to depend on the situation. In this situation, our gut told us that local first was the way to go, and it worked out very well that way. The incident command team, ICT's incident command team, it worked. We pulled that group together based on the intelligence that we had where the shooter was near the hospital and then subsequently near many of our sites, our practice sites. And we were able to pull them together, and the decision was made to encourage or tell all of those practices to shelter in place until we had further information about the incident. Because at that point, early stages of the incident, we really didn't know what the motive was. But we were concerned about their safety, so that was important. I can't say enough about practicing. We get together for an annual exercise. We invite all of our local public information officers in. Occasionally we will invite the media in to play with us in our simulation so that they are also familiar with how we respond and what they would be asked to do at that point in time. I will say also, if it's possible in your community, again, we're a small community, but every 6 months or so, we bring all the public information officers from the localities, the police, fire, EMS, the hospitals, together in one location with all of the media representatives for the region, and we discuss what we would do in an emergency and how we would operate, and make sure that everybody has the right phone numbers, contact details, and other things. And that tends to work really well when something does come up, even if it's as simple as a snowstorm. Our crisis communications team worked very well. Our planning, though we did improve on that, and I'll share with you a couple of things we did to improve. Our planning worked well. And lastly, and I mentioned it before, but making sure that we took care of our own was really, really important, and something that we've now added. It's one of those elements that we've improved upon in our plan. What didn't? Well, I told you I went for a run that morning. I went for about a 5-mile run, walked in the door and started managing this, took a 5-minute shower, forgot to eat breakfast. By the time the news conference rolled around at 2 o'clock, I hadn't eaten anything, but I had worn myself out completely. And it was hard to catch up after that. We did it as a team, but it would have taken somebody to force food down my throat prior to that point, and we needed to identify somebody to do that for the team. So we've done that. That's part of the plan now too. Almost every incident I've ever faced, the recommendation and the after action report was you needed to activate the incident command team earlier. And in this case, we probably did need to do that too. And I would say that in subsequent crisis communications team activations, that's been brought up too. We needed to get more people involved sooner. And lastly, and this is more of a detail, but something just to consider, and I'll toss it out to you. We have a lot of facility space where we could accommodate 100 reporters, say. What we didn't have was a place near one of those news conference sites that we had identified that could take 45 satellite trucks. So we had to rethink our approach to that. If it were a local incident, we needed to get our local media together, fine, our plan worked. If we had 40 satellite trucks parked somewhere, we really needed to make that a much larger space and give some extra thought to that. So we've done that. We've got several parking lots and open fields that we would be able to use for that in the future, and some innovative ways of using parking garages and other things like that. But that was a key element, something that we've changed in our plan. Before I wrap up, I wanted to throw out my top 3 bits of advice as you develop your plans or as you update them. The first one is plan and practice don't just make plans. The plans themselves will almost always fail at the time of battle, and if not fail, definitely evolve. The act of planning, however, is probably the most important thing you can do with your teams. So getting people around a table and throwing out some what-ifs is critical. And it can be as simple, and I've worked with small organizations of 10 or 15 members, 10 or 15 employees who would, on a quarterly basis, get together over a lunch and play the what if this happened, pull the newspaper out and say, what if that headline was us, and how would we respond to that? And even over an hour-long lunch, you can get some good indication of how you might respond. And capturing that information and putting it into your plan is really critical. It also keeps it top of mind for people. There is a difference between responding and reacting. And almost every incident that I've ever been involved with involves an element of reaction in those initial phases. What I would say, though, is the faster you can move to an intentional response, the better off you will be, and the better off your organization will be, your community, your communications, all of that. Everything will be better if you can move quickly to an intentional response. And that involves some anticipation. And our emergency manager at Carilion likes to put it that almost any of us are resourceful enough to react to a scenario. What it takes and why the organization even has an incident command team is to anticipate and respond early to those things that we might think are coming. And proven time and time again, that the better planning, the work that you do to anticipate those needs will take you a long way. And then lastly, I'm going to emphasize this point again. Don't assume that all is okay with your team members and those who have responded in one way or another. I've been a part of enough situations where you never know how people are actually feeling following an incident like this. And that's critically important that you incorporate that into your plans. With that, I think my last word will be about Adam and Allison. And they were wonderful people, and my team and I thoroughly enjoyed working with them. Those of you who work with the media on a regular basis know that there are several different types of reporters. There are the ones that are the hard-nosed investigative journalists, those who love the hard news and live and die for that, and are somewhat tricky and sneaky in how they get their stories. And then there are the other types of reporters that truly love what they do and love telling the community stories. And at their stage in their careers, Adam and Allison truly loved their community. As I mentioned, they were hometown kids, and they loved telling the good stories about what was going on here. And their loss was a significant loss for our community. I hope that the advice that I've offered here today and the experiences that Carilion had can improve your response plans, and that the work that we did that day is useful to others, as I'm sure, unfortunately, it's not a matter of if these incidents will occur again, it's a matter of when. And with that, Lisa, I am happy to take questions from folks and do my best to answer them.
And we have quite a few. So I'm going to take the presentation mode back from you. So hang on, everybody, for just a sec. If you need to get a hold of Chris, there is his contact information there. Please feel free to take down that information. And Chris, thank you so much for a presentation. I think you touched on a lot of important points that how to put a plan together, and then also there's a lot of compassion in your plan where you're thinking about the patients, you're thinking about the community and how to best serve them. I think that's one of the strongest things that you can do as a healthcare facility is, prioritizing the community that you serve, and I think you did it in an amazing way.
Thank you very much.
You're welcome. I am going to put in the chat box my email information. If anyone has follow-up questions that they have for us or for Chris, I can also take them and get answers for you, so just let us know. And I did want to let everybody know that emergency preparedness is definitely our sort of main reason. Everbridge was created from 9/11. One of the things that we learned, unfortunately, during that crisis is that a lot of communications teams then had separate communication networks that didn't talk to each other. So fire departments couldn't talk to police departments, couldn't talk to EMTs. And so that was sort of where the genesis for Everbridge came from. And we've been very successful at pulling communities together. If you sort of fast forward from 9/11 to the Boston Marathon, the city of Boston and the police department and fire department were all on our network, and they were all able to talk to each other very quickly and get on top of the situation. We had a situation in Boston where there were over 270 people with injuries, and they all got evacuated to hospitals with less than 90 minutes, which is just sort of amazing how life-saving a good, strong communication tool can be. We do also provide IT services, so one of the things you might have to battle on a regular basis is EMR downtime, and we do address that as well. And then for community engagement, we do a lot of work around that, anything from a fun run for your hospital to looking for blood donors during an incident like the Orlando shooting. We can handle all of that as well, and we are a HIPAA secure communication tool, so if your clinical staff is looking for a way to do teleconsults, telehealth, anything like that, you can do that through our network as well. One of the things we like to think about is good communication is good medicine. So the better you can get your lines of communication flowing, the better it's going to be. With that, we're going to go into the questions now. There is my contact information, and you can also follow us on Everbridge. We have, for healthcare, we have at EB Healthcare if you want to follow us there. And the first question, Chris, is what resources did you use for developing your plans? And the person was talking about possibly government sources or other hospitals or Joint Commission guidelines. Like, how do you pull your plans together?
That's a great question. And I need to reach back in the memory file on this one. So I have created so many crisis communications plans over the years for various needs that I used a template. Well, a template may not be the best word, but I used a model that I worked on at the World Bank and in the United Nations when I worked there. And it was one that we developed with a consultant at the time through an iterative process and sort of a facilitated working group way. And I found it very useful in when we at the World Bank needed to respond to incidents. So there's a lot to go there. I will tell you that a lot of the government plans that I've seen are more, and again, I'm only talking about the ones I've seen, are a little bit heavier, maybe that's the best way to put it, than I would like to have had in an emergency. And so ours, when it gets down to it, the key pages are maybe 4 or 5 pages of our plan, the response section. And that's about, we're all about simplifying here. So I wish I could give you more of an example, but I think, over the course of my career, sort of learning what works and what hasn't worked, and seeing tons and tons of plans, I think that's basically where I am.
I did like your idea also of like looking through the local news and was like, this happened at this other community, how would we deal with it here? I think that's actually really relevant. I don't think people necessarily think about those worst case scenarios because they know their community and they know it's a great community. It could never happen here. So I think using the newspaper as a source to challenge yourself is a good idea. The next question, which he did say, he prefaced it with he is a lawyer, is at what point in the communication tier, so he was like, how come it wasn't in tier 1, but at what point in the communication tier would a legal person be brought in for consultation?
Yeah, so legal is so I'll put it this way. We have a crisis communications team. We also have an incident command team. And the incident command team is responsible for managing an incident that impacts us or that we are responding to. So we might activate our incident command team should there be a major mass casualty event in the community, because taking those numbers of patients into the hospital would impact our operations. The incident command team, I believe, has our legal resources on it. And luckily, I have great relationships with our counsel, internal and external counsel, and often bring them in if anything goes outside of the parameters that we've already set. And so, for instance, I work with HIPAA all the day long. I know HIPAA in and out. They're confident that I know HIPAA. We don't have to worry too much about that. We get the consent signed. We do that work. But if there were anything outside of the parameters that we've already discussed in our regular meetings, then legal would certainly be involved in that.
Great. Okay.
Tier 1, tier 2 depends on the incident.
True. Yes. And then this actually sort of follows off of that question: is how was your media response coordinated with the local authorities? So how were you communicating with them during the crisis?
So again, through our incident command team, we have very strong connections to our local responders. Because we're the level 1 trauma center, they rely on us. We are a community resource for them. So we work very well with them. In this case, the only part of the strongest coordination happened on that first day when they were the FBI, the NTSB, and the law enforcement officers in Franklin County, public safety officials in Franklin County, had pulled together their news conference. and I was invited to that, and so I participated in that and was able to give additional information to the media at that point. But beyond that, we at Carilion were not as involved in responding to the actual events on the ground at Smith Mountain Lake because that response was really handled by the local authorities. We were involved once the patient got to our facility, so it didn't need to actually connect with them too much after that.
Okay, and do you have time for one more question?
Yeah, I'm happy to hang around. So if there are other questions.
So we'll do one more question. And has this incident caused hospital administration to make security a priority? And is the CSO included in planning and is more allotted in the budget? So did this incident sort of shift your perspective on security along with emergency alerting?
So the short answer to that is no. We've always had a very strong focus on security in the hospital. We actually have our own, one of the few agencies, private police agencies accredited in Virginia. So we actually have a police chief who has, he and his officer have arresting power and all the authority of a police officer in our jurisdiction. So we have a pretty strong security program. The police chief and I are on first name basis and on speed dial, and we alert each other to what's going on a regular basis. So there's a strong connection there already and had been prior to this point. I don't believe that anything changed following this incident. We had been, from an active shooter perspective, should somebody have tried to breach the hospital and get in, we have been planning and practicing for active shooter scenarios for several years prior to me joining Carilion 2 years ago. And we use a lot of executive communications to remind staff of their role in security at Carilion, that it's a shared responsibility. So it didn't change, it didn't amp up at all, but it was an affirmation that we were on the right path. So hopefully that answers that question.
Great. Yes, thank you very much. That's impressive. You have your own police force. So we are going to wrap up at this. Yeah, we are going to wrap up at this time. We will be sending out the slides, some other resources that were mentioned throughout the webinar, and we also will send out a recording of this webinar so that you can show it to your colleagues as well. And honestly, I urge anyone, if you didn't get a chance to ask your question, please email me, lisa.johnson@everbridge.com, and I will be in contact with Chris and we'll be collaborating on answers for you. So that is it. Please feel free to check us out at everbridge.com, and we look forward to seeing you all soon. Chris, one last time, thank you so much for being here today.
Thank you all.
Bye.
Bye.